Thank you, Marilyn, for such a nice introduction. Thank you all for coming. I'll try and keep energy up. It was hard after seeing the last round of people flying through 5-minute talks. I'm going to feel like I'm going at a leisurely pace here, so try and keep the energy up. As Marilyn gave a great introduction to this panel, one of the things that I really want to focus on, you'll see it in the subtitle of my talk, is both the potential and the pitfalls of using big data and geographic big data in particular for neighborhood research. So I'm going to start by motivating some of the substantive questions that I'm interested in, one of them being, based on Mark's talk this morning, by 2030, 1 in 5 Americans will be over the age of 65. But will our neighborhoods support healthy aging to be able to accommodate that population? At the same time, 70,000 pedestrians are killed or injured in the U.S. each year. Of those, 8,000 are 65 or older. So these are major health implications, right? They're not necessarily, the aging part we've talked about quite a bit, but one of the things I haven't heard a lot about is pedestrian injuries, but car fatalities and pedestrian injuries are some of the most largest number of injuries. And so what we're going to do is use Google Street View to try and turn data into that's collected all over the country, right? So this is, for those of you who've never seen Google Street View, it's a system of pictures of every block in many metropolitan areas, but we want to turn that data into useful data for academic research. And so this is a non-trivial task, as we found out. We thought it was going to be a lot easier than it was in some ways. And so what we're trying to do is to do this in a way that will be valid, reliable, and cost-effective. And so we basically had validity taken care of. There's been a whole bunch of studies that have looked at how neighborhoods, how Street View has corresponded to in-person evaluations of neighborhood environments. And so what we find is that in most cases, the observations we see in person and the observations we see evaluate on Google do a pretty good job matching up. There's some that don't, so the smaller the item, the more transient item, the less well we are able to capture that and match it. So things like litter are a little bit harder to get than something like a boarded up building. So there are validity concerns, but they're outweighed by the pure cost effectiveness, which I'll talk about later, of using Google Street View and the kind of scale that we can get from Google Street View. So my team developed the computer-assisted neighborhood visual assessment system. You might be able to see why I'm no longer in architecture school and decided to get a degree in sociology from that logo, but we're getting there. This is still very much alpha version of what we're doing. And so the guiding priorities for Canvas we had 3 guiding priorities as we were developing it. The first is we wanted to reduce measurement error due to controllable factors. So any of you who have experience in survey research know this kind of literature very well, right? You have response categories. You make sure that interviewers, as they're asking respondents questions, get an answer and that the answer satisfies certain criteria before you move on, right? So you don't want someone who's 1,000 years old, for example, because they're not 1,000 years old. And so that's one of the first things we wanted to do. The other big problem for Street View, and Street View studies have been used before, is trying to get to the correct street intersection to rate. And so if you're not getting to the correct intersection, then you're rating the wrong thing, then you can actually be building measurement error into your study unintentionally by not having those kinds of checks and balances in place. We also want, and so we're going to go in order, I think, of kind of most successful thus far to where we're developing. The next is we want the system to require little technical expertise to deploy and oversee data collection. As I said, we're still working on this area. We have a very talented programmer, but a lot of the work still has to be done on the back end. But what we're hoping to do is turn this into a product that folks can use, and you could basically sign up, get an account, and it would be more consumer facing. Now, the funding models for that are a little bit different. They're a little bit harder to try and find without a business partner. And so that's part of what we're trying to figure out now, is how to build that system under kind of traditional NIH or models of funding, where you're really looking at disease outcomes rather than kind of big models to put forward. And the last thing we want to do, and this is kind of our most pie in the sky, but we hope that we will be able to help the population health community as a whole develop standard data collection items and processes. And so what we're hoping to do is, by having this standard data collection method with standard questions in it, you can select from the standard questions, and so we're all using the same questions when we're doing our studies, rather than having similar things measured in very different ways across different studies, which has been a problem for neighborhoods and health research, which is the area I know most, but it's also been a problem in pedestrian injury work, on how do you measure the kind of traffic flow and things like that. So we're trying to encourage standard data collection processes and the particular items across studies. And so our platform is developed in a web framework called Django, which is built on the Python programming language. And the web application has three interfaces. There's a study manager interface. So this is when someone goes in and actually designs the study and implements it so that raters can rate. Of course, you need the auditors. So you need the raters who are actually going to go and audit the streets. And so this is kind of what I'm going to show you the bulk of today. I have more on some of the study manager interface if you're interested in the question and answer. And then finally, we have a basic analytics. And so one of the things as we were developing this is we wanted to know whether the items that we were measuring were being reliably measured as we were training the raters to rate. So we actually have kind of real-time analytics of kappa statistics and interclass correlations, things like that. And so I'm going to show you the auditors, an example of the auditors interface. So they would go to the login screen with our beautiful logo. And then they would say that they want to start rating. And so what would happen is they'd bring up a image of the street that they're supposed to walk towards. We had raters rate to the right side of the street. So you can see they walk from the green arrow to the red arrow. This minimizes the error of rating the wrong street or the wrong side of the street. And so then they can turn around. And then on the right side, they have the instrument itself that they're going to respond to the questions about. And so there's pages of this. This can be paginated, which we did. There's skip patterns built in, and several lessons that we've learned from decades of research and survey research of how to try to design these better. And this right now is set up kind of on a single screen because although we have three screens, I can't make them be different. This is set up to be on a dual monitor setup. And so to make sure that, as I mentioned, we are pretty confident that the measures are valid because they've been validated in many cities over several different studies that I showed you before, but we wanted to make sure that the measures were reliable and that raters were reliably rating the items on the street. So we conducted a national reliability study. We sampled 150 streets, and so you can see the coverage is decent, and it's 68% and 60%, 68% in cities, 61% in metro areas. So we define the central city as the city sample. This is not 100% obviously, but one of the things that we find that's going on is Google is adding more and more streets all the time. So 70% and 61%, which is what we did 2 years ago, is going to be the very lowest that we would ever get, right? It's going to keep going up from there. Many of the places, so if you think about metropolitan areas, if you think about even the DC metropolitan area, about 5 miles from here is an agricultural preserve in which there's no street view, but it also makes a whole lot of sense that there's no street view because it's literally farmland for miles and miles and miles in the entire eastern or western half of Montgomery County. So what we did was take existing protocols of studies that have been validated in person. So we took the pedestrian environment data scan by Kelly Clifton at University. She was at University of Maryland. We took the Irvine, Minnesota inventory, which is a huge list of about 120 items, and we took the National Center for Smart Growth Research and Education. They had a similar one. And then we also took parts from the Project on Human Development in Chicago Neighborhoods. So some of you might know that as Rob Sampson and Steve Raudenbush's study, where they developed systematic social observation as kind of a tool to be used and deployed on a large scale within sociological and social research settings. And we also use the observational validation of urban design measures that was developed in New York City. And so we took literally the exact training materials from each of these instruments to train our raters on each of the items. So this was 187 items. We had 157 segments on 187 items, each of them rated by 3 raters. So we had a total of 84,150 ratings that we were evaluating in this study. So it was a massive undertaking, and we finally finished it. The inter-rater reliability, we just published this beginning of the year in Health in Place, varied a lot across different items, and so land use was kind of the most consistently rated, most reliably rated, and most consistently rated among the raters. So that's things like, is there commercial use here? Are there single-family homes? Are there apartments? Sidewalk measures actually did pretty well. You can see most of them, and I'll use this screen here, cluster around kind of 0.8, which is what we would expect as high reliability. It's kind of, if you get above 0.8, you're doing very well. But some items kind of move down here as well. And then you start to get more down, you get more, both the mean drops and the dispersion increases across the items. And so some of the things that we were able to access least were pedestrian access, which makes sense. A lot of those items were items that were best seen from the sidewalk. And so remember, Google Street View cars driving down the street, which is not unlike what Rob Sampson did in the Project on Human Development in Chicago neighborhoods, but it's very hard to see things on a sidewalk if there are parked cars or other things there. And so some of those items were the reason that we did not do as good of a job. So I also wanted to, as I mentioned before and as Merlin alluded to, I also want to mention some of the problems that we've seen with Google Street View. And you might recognize this place. It's a beautiful place where you are all sitting right now. But if you notice, when I bring it up in my browser, you'll notice on the browser bar right here, it actually has our address. And so that means that I am giving Google my address in order to rate this street. It's not a problem. We're at the National Academy of Sciences. Everyone knows where that is. It's actually a spot on Google. I was able to get here, using my smartphone because it knew where I was. But say I was going to your home, and I wanted to measure the street in front of your home. If I use your address, I have now given Google your address, which means I've violated most IRB protocols for protecting personally identifiable information. And so this is a huge problem that we've actually seen. Studies have done this, and it's been a problem where I, as a reviewer, have pointed this out to editors and as my colleagues, so I apologize if any of you are the authors of those papers, but it's something to take really seriously. And so what we've done, this is going to be in an editorial, it was just conditionally accepted in the American Journal of Public Health, is basically look at the ways that we could try and get around this. And so one way, the direct geocoding is what I just mentioned on the top here. You take the blue star, which is the respondent's address, you give it to the third-party service provider, they do their magic, and you get the information back that you want after that. One way that we've seen a lot of people try to do this is by creating a bunch of spoof addresses. And so we call this kind of the needle in the haystack method, where you would hide the needle of the respondent's address in a haystack of a whole bunch of kind of junk addresses. And besides being inefficient, it also means that the service provider still has the respondent's address. So you still pass personally identifiable information to the service provider, whether that's Google or the New York Times or WalkScore or any of the other services that are used. And so you still get the data back for that spot, but in order to do it, you've violated probably IRB protocols. The two ways that we think are more appropriate are the one that we have used, which I'll talk more about in a second, which is geographic sampling. So rather than use specific addresses, we sample an entire area and then describe the area around that respondent. So this is best for studies where you have multiple studies in the same city and you can use the same study over and over again, the same base data, where you have different human data kind of that you can link to the same neighborhood environment data. The second is probably better for areas where you have a dispersed sample. So say if you're working with a PSID where you don't have a sampled construction, you can match an address based on known characteristics. And so it's very much like missing data or missing imputation. It's just doing it geographically. You can geocode that address. It's not the respondent's address, so it's fine to pass it to Google. And then you just link them back in a desktop GIS where you can maintain the privacy of the individual's data. And so to give you a sense of what this looks like, this is a sample. This is our study of Philadelphia that we published in American Journal of Epidemiology at the end of last year. The green segments are the segments that were street viewable. The red X's are where there was no street viewable section. Again, you see many of these are in Wissahickon Park and other places that we wouldn't imagine Street View to be. And so what we do is use a geographic geostatistical method known as kriging. And basically what this means is instead of taking track boundaries, Block A and Block B are in different tracks here, but we think that they're probably more alike because they're closer to each other than Block C and Block B, even though Block C and B are in the same tract. And so kriging is a method to try and get around that. And we've talked about this in a couple of papers. And so what we can do is turn these sample sections then into a surface map of disorder in the city of Philadelphia. And so green here actually represents more disorder, red less. And so those of you who know Philadelphia know that Center City is much less disordered than North Philly, West Philly, or South Philly. And so that is how we're able to do it. And then from that, you can construct neighborhoods in any dimension that you want. This is a paper from my colleague Gino Lavasi, where you can draw different subject addresses, different subject neighborhoods based on that heat map layer. So that's where we are now, and so that's I think it's pretty cool, and it's been fun. But the next kind of big thing is being able to scale this up to a national sample and being able to get national data. And so we're working with some computer scientists to use Amazon Mechanical Turks to collect the data, but not so much to collect the data as much as to test methods to create image processing software so that we can actually look for things like curb cuts in the data itself using a computer, and then verify it with humans. But that will increase the efficiency of data collection. We're working with a computer scientist, one American, another at University of Maryland College Park, who's done this using curb cuts. He's interested in disability, and so we've been able to do this. And so then what we would want to do is be able to release this to communities and community groups so that community groups can have ratings, and we'll rapidly test this on the Amazon Turks to say, can you do this with very little training? Because community groups often don't have a whole lot of resources to do a bunch of training. And so the Amazon Turks will kind of be our test case, and then we can give it to community groups. And so then hopefully what we'll be able to do over the course of time is build up a data set, a nationwide data set of those heat maps for metropolitan areas across the country. So in closing, I want to say thank you for coming and for being attentive after a wonderful lunch. I also want to thank my collaborators, Stephen Mooney, who's done most of the work on this, Andrew Rundle, Kathy Neckerman, Julian Teitler, Gina Lavasi, Daniel Sheehan, and Yanjin Lee, and also funding from the Health and Society Scholars Program, which I benefited hugely from as a scholar, and also the National Institutes of Child Health and Human Development. So thank you very much.